if you can look back, what one pool of wisdom that you would give to a Black individual who's entering or aspiring into a field of nursing or wellness coaching?
Embrace your passion.
Mm.
Your passion is your powerful motivator. So if you take that passion and let it guide you into your goals and your career goals or your personal goals, and then put that, let it come from the heart. And then you will have all the success in the world. Now, you still have to be resilient. Don't forget the resilient, because I always have to add that in there. But just embrace your passion and do whatever it takes to get there. And then you will be the happiest person in the world.
Hello, listeners. Welcome to the You Belong in Here podcast. This is a podcast where we explore the intersection of nursing and racism, racial disparities that African Americans face in healthcare, as well as the inequities that African American nurses, doctors, and nurse practitioners face in the workplace. My name is Dr. Tiffany C. Brown, and I am your host. I am a doctoral level nurse practitioner with more than 23 years of practice in the nursing profession. It is my hope that through hearing the personal stories of triumph and resiliency shared through in-depth interviews from nurses, nurse practitioners, doctors, and DEI experts, you will be empowered in your workplace and know that you belong in here. Now, let's get to our show. Hello, everyone. Welcome to another episode of You Belong in Here. Again, I am Dr. Tiffany C. Brown, your host. I am thrilled to introduce you to my guest for today's episode entitled Empowering Wellness, the Role of Life Coaching in Nursing. I am super excited about today's episode because as a nurse, specifically as a Black nurse, I have learned that we as nurses sometimes forget to prioritize our own self-care as we focus on taking care of others. Now, if you can relate with me, then this episode is for you. So let me tell you a little bit about my guest. Again, her name is Dr. Darlene Dansby. She was born in New Orleans, Louisiana, has been married for over 40 years, y'all, is the proud mother of 5 successful children, 2 physicians, an attorney, a registered nurse, and a counselor. She has over 30 years of nursing experience at veterans hospitals. She has worked in 13 different VA medical centers, y'all. Currently, she's a wellness and life coach and self-care retreat planner. Her career includes roles such as clinical professor at Middle Tennessee State University and the University of Tennessee in Memphis. She retired as a nurse practitioner with the VA-MC. Her academic credentials include a BSN from Northwestern State University, an MSN FNP track from Concordia University, as well as a DNP from the University of Tennessee. And let me just top it off with a postmaster's PMHNP certificate. Though she is passionate, if you cannot tell, about nursing and dedicated to many years caring for veterans. So welcome, Dr. Dansby.
Thank you for that introduction. And I'm so happy to be here today to share my insights and my experiences in the nursing profession. So I'm so happy to be here.
Again, I'm excited to have you because, as I mentioned before, coaching and nursing, mentorship and nursing, they kind of go hand in hand. And there's several articles and things that I read, which we can get right into it, that coaching and mentoring play a vital role in all nurses' professional development and growth. Like the coach can act as a catalyst, facilitating self-discovery, providing accountability, and offering support throughout the journey. So, Dr. Dansby, can you share your journey into nursing and then the transition to becoming a wellness coach?
Absolutely. I would like to share a little bit of my journey. I know it's been like 30 years, so it would take all day for that. But I'm so excited to share. I started off as an RN BSN in 1992, and then I worked in critical care. And then 10 years later, I decided I wanted to work in primary care, so I went back for my FNP. I did primary care for several years, and I thought about it. I said, I need to give more. I want to give more. So I went back for my DNP, and then I started working. I say, well, it's something else I want to give. I say it's more out there. So I saw that they had issues, mental health issues going on, I say, let me think about another. I'm one of those high achievers. So I say, let me go back to school. So I went back for my psych NP. So that's what I'm doing right now, working in my virtual clinic as a psych NP and also as a wellness coach, because I feel that those two kind of connect together. So we'll talk about that later, but I just wanted to share that my journey started off as an RN, and now since I am working toward wellness and mental health, it just kind of did a transition. And I feel that nursing needs mental health care and self-care. It need to be addressed. It need to be addressed. And the reason why I decided to get into coaching is because of my experience working in the academic setting, because I did work in university, and it was with predominantly white, it was white university. So you know what that means. We didn't have the mentors that we needed for our Black nurses. And I felt the pain. I felt what these nurses was going through. I was probably the only Black professor at the time. And I was trying to mentor them, and it wasn't enough for us that could maybe talk about the backgrounds and understand what they're going through. So that's what kind of put me in the arena of wellness coaching, because I want to help nurses, empower them to seek their career paths, instead of just saying that this is your way, this is your avenue, this is your path. I just want them to kind of see that they can do everything that other people do of different color or different races. So that's why I got into the coaching business.
Absolutely. I really love how you, just from your journey from RN to FNP and the path you took even to become a psych NP and being an academic, said, you know what, I understand and see how important representation matters and can see what is missing. I'm sure, I know you didn't talk about your personal schooling, but I am sure, as with myself, when I went to school, I was a part of the 2% of African Americans at a school that had 27,000 students. And as hard as it is to get into a nursing program, there really wasn't any representation in the program. So I want to kind of ask this question. How has your identity as a Black nurse practitioner influenced your approach to nursing and wellness coaching?
Well, my identity, being a Black nurse practitioner, has molded me to be the person that I am. And I solely believe in being strong in who you are. And if you don't believe in yourself, who else going to believe in you? So I grew up in New Orleans, and everybody say, "Oh, you have that accent, you have this and that," but I embraced it, and that's who I am. And that's why, as being a Black nurse practitioner and working in the nursing profession with others, with other white professionals, I always feel the sense of isolation, but I always felt like I had this resilience to build myself back up, because if you don't be strong for yourself, who else going to be there for you? So when I just, like I said, just being a strong, coming from a background of strong women, because my mother is very strong. She's a nurse as well. And, back in the day it's totally different. So she struggled more than I did, but she always supported me and say, Darlene, you can do this. You can go, the sky's the limit to you. So just being a strong person overall and being a strong, have a strong family support is what made me the person I am today.
Well, awesome. I almost want to say amen. It's hard to describe how the African American woman strength and resiliency seems to be in our blood, regardless if you're in the nursing path or any other field. If you're out there and you're listening and you're African American, I'm sure you can relate to any part of this podcast, especially what Dr. Dansby is saying about where she got her strength from. She saw it bringing up when she was growing up. Mom showed her how to be a strong, resilient person. But it is sad, though, isn't it, that we have to be strong,
Mm-hmm.
resilient in our workplaces. What, don't you think so?
Yes, the strength comes from within. You have to be strong within. And I have 5 children, and they are very successful. And they've been knocked down here and there, saying that they can't be a doctor. My daughter, they told her that. You'll never be a doctor. And I just say you can be it. Don't let people on the outside tell you what you cannot be. And also that resilience. You're gonna have setbacks. You're gonna have challenges there. But in order to move forward, that's your stepping stone. That's the way to get to the next level. That's a learning path. That's the way you get to the top. If you don't struggle, sometimes it's not even worth the success sometimes. I enjoy struggles because I'm learning at the same time. So I all that word resilience is the key to me. That is a strong word. I live by resilience. I really do. So I mean, if anybody take anything from this podcast, resilience is the key for success.
Oh, that's right. Yeah, you cannot just let things make you stay down. You got to be able to bounce back,
Exactly. Exactly.
That's what, is the makeup of resiliency.
Hmm.
So, why do you believe nurses need wellness nurse coaching? And how do you believe coaching is different from mentoring or mentorship?
Okay. First of all, like nursing, Black nurses, and people are underrepresented the groups, they struggle more. They have more challenges. They have racial bias. They have microaggressions. So they have to deal with more job stresses. They already have the job stress of being a nurse. On top of that, they have the different challenges of the microaggressions, like I mentioned. I know you probably experienced it before. Let me touch your hair. Let me touch your hair. Let me see. Is it real when you have braids? And also, and then you might be in a meeting one day, and then you sitting there with all the great ideas. But guess who gets the credit for the ideas? Not you, right? You might develop the program, and you may not even get the recognition for that program. I've been there, done that. So we deal with so many stresses, job stresses alone, and on top of that, racial bias at the same time. So wellness coaches can help nurses get through that. They can help them with the emotional and the mental challenges that they may go through. And also, we can also help them with self-care. Because if you pour from an empty cup, how can you take care of that your patients?
Hmm.
It's just so much that nurse coaches can help nurses with. Is to help them meet their goals in life. If they have something they want to reach, even if they want to lose weight is a common thing. Even if they want to get more rest at night from working long hours, long shifts, we could help them reach their goals in life. And once they reach their goals, they're going to also be better for their families, take better care of their patients. So if you take better care of yourself, everybody else going to benefit at the same time.
Hmm.
So and when I say wellness, think about physical health, it's holistic health, mind, body, and soul. It's the whole picture. And I always believed in that, even as a young nurse. I never went in the room just take care of the number of the patient, room number. I took care of the whole patient. I communicated with my patient. I wanted to see where their mind was. I didn't even know I was practicing holistic health in the 90s. I really didn't. But when I started thinking about and reading research, I say, this is holistic health I've been doing all along. And that's what wellness coaching is all about, is putting the whole body, taking care of the whole person.
You mentioned about microaggressions, and I think this is important to not just kind of jump past, but we know Black nurses often experience racism and microaggressions, which can lead to what? Emotional distress
Yes. Mm-hmm.
and burnout.
Burnout. Exactly. That's the word.
Yeah, the combination of workplace stressors and racism, there's plenty of evidence in the research that shows these type of racism related stress can contribute to burnout and negatively impact a Black nurse's mental health, or anyone else, who may be experiencing those type of microaggressions at work too, that's not Black or is a different racial identity. And I know you mentioned what, mental wellness coaching can do. What specific strategies do you use in your coaching to empower clients to take charge of their mental and emotional wellness? Like, break it down a little bit for us so we can see what that looks like.
Yes, yes, yes. I love it. I mean, it's first of all, we start off with the person. They're the center of this program of wellness coaching. Most of the time, as a nurse, we go in and do orders. We fix this. We try to give them medication for this. But wellness coaches, they're putting the client in the center. So first, we identify what their needs and interests, what their goals are. What are they looking for? What do they want to improve in? And once they decide what they want to improve in, then the wellness coach look at the personalized tailored plan, wellness plan. And this is just focused on that individual. It's not a cookie cutter plan. It sets up just a personalized plan just for that person. And once you determine what's best for that person, what they determine what's best for, not me, it's really them. And what I do, I empower them. I even hold them accountable, not in a sense of negativity, saying you didn't do this, you didn't do that. If they didn't meet that goal for that week, we talk about it. We say, what can we do better? Is it something that we need to adjust in your plan? Everything is all about positivity in coaching. It's all about positivity. And then once you decide on a wellness plan, we look at mindfulness. Mindfulness and stress reduction. That is so important today because if you don't take care of your mind and then focus on and stay grounded, how can you take care of your whole body? It starts off with the mind. So I really focus on stress reduction and mindfulness. And since I am a psych nurse practitioner, I can't get away from it, right? I have patients and clients with anxiety and depression. So that's my life. I always kind of see where my clients are in coaching with stress. The world is stressful anyway. We all have stress. It's normal. We all, taking care of families, taking care of our jobs, taking care of ourselves. Sometimes we take care of other family members. Stress is there, but how you cope with it is what we need to work on. We're going to have stress. After we take care of that, we want to just make sure we tie everything all together. And it's so many different ways that you can approach coaching, but the main focus is to figure out where your client is and what their goals are, and then help them find tools and strategies to meet those goals. And then you empower them and let them know that they're going to get there. It may not happen tomorrow. It may not happen next week, but we're going to get there. So that is something that it's in my heart. I want people to think positive and believe in themselves and that can reach anything they want to reach. They don't have to be broken and feel like they're broken and they can't get fixed. No, we don't want that kind of thinking. We want more of a positive thinking. So that's my generalized approach to coaching.
I love it. So I'm like, okay. One of the things that I like, you have the background to do something like this with that psych NP. And
Exactly.
people know, culturalistically, I guess specifically for African Americans, we're less likely to get any type of therapy. So, this wellness and this coaching, it almost sounds as though it may include, and mental health wellness and those kind of things. It might sound like it might include some type of therapy.
You You said it. I don't know why. You just hit it right there. Cognitive behavioral therapy is part of my plan. Oh, because most of the time, coaches, we just coach, accountability. But I add the CBT because it refrains you from that negative thinking and they give you that positive not a mindset. So once you start thinking more positively, then you'll be more apt to reach your goals.
Mm-hmm, mm-hmm.
So it's almost like reframing. I call it a mindset shift.
Mm-hmm, mm-hmm.
Because it's sometimes people try to, even like with losing weight, I always give that example. I mean, we can talk about diets all day long, but if you don't change your mind on healthy eating and exercising, you can have a diet next week, 1 week, and then next week you can eat a hamburger and don't exercise. So it's really changing your mindset. And that's what it's all about. Those key things, mindfulness, CBT, and developing a personalized wellness plan is just the key to my coaching approach, because with other things, you're gonna accountability that just kind of intertwine with the other with these areas. But those three areas are very important to my vital to my program.
Absolutely. What are some common barriers that you find that your clients face in achieving wellness, particularly, like I said, in our African American community?
Well, like we talked about, the stressors, the biases that we feel, and sometimes the mental health stigma. We may deal with the different stresses and the depression and the anxiety, uh, maybe just not happy on the job. You're dissatisfied with the job, but we have that stigma that we're not supposed to seek help. But nowadays, I mean, just from my experience working as a nurse practitioner in the virtual world, because I do have, like I said, I have a side practice with that. People are coming to me more, and it's slowly, but they are really opening up because they probably don't have nowhere to go. But that's the mostly what I see is the barrier of this mental health stigma, and also the barrier of not having the resources they need for as the mentors of their color that understand their cultural things that they're going through. They may not. How can I get mentored by someone who don't know how what I've been through or what our culture been through? So that's probably the most barriers that I see, because most of the time the wellness people in nursing may not have the time to
Mm.
take care of themselves. They work in them long hours, them long shifts, and they figure that I'm good, I feel good, but they're not getting enough sleep. They having problems, family issues, with their relationships. I mean, I've seen it happen, and they're gaining weight, and they're wondering why they get diabetes early. They wonder why the blood pressure's going up, because of those things that they don't put themselves first. For whatever reason it could be time. It could be think that they don't need to. They don't think they need it because they're young. Because I have children that think that way sometimes. They say they don't think they need appointments.
I couldn't agree more. I almost even want to add, like, because I remind myself, or I can recall multiple times that I've been in situations where I've been at work and I've had to deal with in the moment of these different microaggressions or these biases that I've experienced with patients, but also with colleagues, and I didn't have a safe space to turn to, or anyone that looked like me. Like if I went and got a therapy, sometimes your job offers, what is it called, like, when your job,
EMP.
yeah. And then you go to that, and then the person that you're talking to doesn't look like you, is not from your culture, and doesn't really understand, doesn't have that cultural sensitivity.
Exactly.
They can be, what's the word, empathetic,
Right.
necessarily be able to advise you in a way that's empowering. So
Mm-hmm. Mm-hmm.
as far as barriers, I would say that's a barrier can be at your job, and I think that's a good place where you could come in and maybe, girl, even get employed at some jobs,
Exactly.
some type of program like that, because it's definitely needed for people of color.
Exactly.
So I want to ask you another question. Can you share like a success story where your coaching made a significant impact on a client's life that you could see?
Right. Okay. So I did have a client, again, working long hours, on the verge of burnout, uh, those 12-hour shifts and not getting enough sleep. And then when they came to me and they were saying, I don't have time for my family, my husband, I'm grouchy at home. And and the first thing I asked them, I say, I mean, what do you want? What's the picture? What do you want it to look like for you? What do you want your normal day to day to look like for you? And what makes you happy? And then once they say, I just want to get more rest, and I just want to feel better for myself. And then we start tackling what goals they want to reach, and then we talked about that. And then they even develop a mindfulness routine, and they do have apps for that. You can do the Calm Space, you can do Headspace. And so I always start off with that, because like I said, the mind, start with the mind. And then once the nurse started working with those different apps and them different programs, and they started doing breathing exercises, because I didn't do all of that back then. I didn't know anything about mindfulness. But when I started practicing it, because I'm not going to teach anybody that I'm not doing things that I'm not doing. So when they started working on those different things, and they were feeling more relaxed and they was getting more sleep, then it felt like they were giving more to their family. They were being more productive at work, and they would be having a better relationship with their colleagues. So it's what it is, just simple things. Sometimes we think that it takes a lot of work to get feel better. A simple practice of mindfulness, and then having someone to coach you through it, or have someone to be there to support you and guide you. That makes a big difference. That makes a big difference. But that's one of the things that stand out to me, because I know that a lot of people don't believe in mindfulness. It's like, what is that? A lot of us Black people don't believe in that. They're like, just move on. But just taking the time for yourself, and it's really getting you centered and gathering your thoughts of
Mhm.
the day. So that's one of the success stories that
Yeah.
I share.
Well, literally, the battlefield is in the mind.
Exactly.
Someone wrote a book. It was a preacher wrote Battlefield of the Mind, right? Was it T.D. Jakes that preached one of these preachers,
Hmm.
leaving me right now, wrote something called Battlefield of the Mind. But really, mindfulness kind of helps with the battles that we have in our mind.
Exactly.
Utilize
Mhm.
that. What other resources? I know you mentioned some apps. What other resources or tools do you recommend for individuals who are seeking to improve their mental health and their wellness?
Yeah, I love audiobooks. I love that. And also I love to go to Amazon, and I just do a search. I love anything that says self-care. Anything that say this is a pretty good book here. It's extremely busy woman's guide to self care, and it really, how sometimes you feel like, how can I do all this stuff and take care of me? It's ways to do it. It's ways to do it. I mean, you can have. I had 5 children. Let me give you an example. 5 children, 4 stair steps, and the last one came 7 years later. It was an accident. No, he wasn't. No,
That's
I
not
wanted him.
yeah.
No, I wanted him. No, but the thing is, it's just that I made sure that I was taken care of, because how am I going to have energy to take care of my children and my husband? And I was working as a nurse, working night shift. I mean, I had to cut down on some of the hours because I needed time, some rest. But I did cut down on the hours, and I cut down on spending at the same time. So it's just one of them things that we have to prioritize things that's most important to us. And what's most important to me is taking care of number one. I'm never going to stop on that rampant. You have to take care of yourself. And if you don't, what else? How you going to take care of other people, and how you going to live a happy and healthy life without taking care of yourself? So that's what this anything self-care. And like I say, the mindfulness apps are wonderful. I do work with head you ever heard of headspace and growth therapy? So I do have I'm working with them because they are so, take care of all of the administrative work. So if someone is seeking therapy, or they're seeking medication management, the virtual world is there for you. Digital, you don't have to go to the office anymore. You can do your visits in the privacy of your home. Nobody has to know. If you don't want anybody to know, it's just going to be you and your therapist. So do not hesitate to go to different resources. Even the Black Nurses Association, they have resources for mentoring, coaching, I believe. So they do have resources. It's so many things out there. The sky's the limit. If you do a Google search, you will find something.
Mhm.
It's there.
I want to actually, I know we're coming close to our 30 minutes, but what
Hmm.
else? You've given so many pearls already.
Hmm. Hmm.
If you can leave us with one awesome pearl that you would give to Black individuals, Black nurses, or anyone, like your children have, been are physicians, attorney, and counselors themselves. If you can look back, what one pearl of wisdom that you would give to a Black individual who's entering or aspiring into a field of nursing or wellness coaching, what would you give as a pearl?
Oh, yeah, I do have many, but this one here it stands out, is to embrace your passion.
Mm,
Your passion is your powerful motivator. So if you take that passion and let it guide you into your goals and your career goals or your personal goals, and then put that, let it come from the heart. And then you would have all the success in the world. Now you still have to be resilient. Don't forget the resilient, because I always have to add that in there. But just embrace your passion and do whatever it takes to get there. And then you will be the happiest person in the world.
absolutely. Well, thank you so much for all wonderful pearls, Dr. Dansby. And folks, this concludes our podcast episode. And we had such a wonderful guest who shared all these wonderful pearls of wisdom and her nursing journey into becoming a wellness and life coach. Thank you again, Dr. Dansby. And thank you guys for all listening again. Thank you for tuning in. We hope this episode, like all, remind you that your presence is necessary. You belong in your workplace. You belong in your place of education. And as usual, if you found this episode encouraging, motivating, inspiring, or empowering in any way, please like it and share with others. You can find my podcast on Spotify, Apple Podcasts, and soon YouTube. And Dr. Dansby, I will put all her links in the episode notes where you can find information about her, because she's planning some wellness retreats pretty soon. So we want to stay up to date with that information. So we'll see you back in 2 weeks, where we continue to explore topics in equity in healthcare and equity in the workplace. So until then, take care and keep pushing forward, everyone.
Thank you for having me.
Absolutely.